In the era of COVID-19, misinformation can spread faster than the virus itself. What science knows about it can change from one day to the next. This is why it's so important to have real-time, safe and secure mechanism to provide information during a pandemic. But communication has changed, and the way we communicate to our citizens has changed. What used to be straightforward and centralized through newspapers, radio and television now is decentralized and less easy to communicate. There are now over 5 billion people with mobile devices, social networks, and in the absence of correct information, misinformation and memes can spread virally almost faster than the virus itself. This is why we built Health Alert together with the Department of Health in South Africa to combat misinformation and to provide secure and accurate information to every citizen in South Africa. At Praekelt.org, we believe that basic information is a fundamental human right. And we've been working with governments over the last 10 years to build systems to provide access to health services and educational services throughout the continent. Mom Connect is one of those. In South Africa, more than 1 million mothers access information about their pregnancy and about their babies through a WhatsApp line and through their mobile devices. We've learned over the last couple of years how to provide not only information, but also guidance throughout the pregnancy. And we've learned how many different ways we can provide this guidance and how questions can be asked over a mobile device, not only via messaging, but also sometimes as video clips, audio clips, or images. So the building blocks were already in place with Mom Connect that we could repurpose for Health Alert in South Africa. So in a couple of weeks' time, in March of this year, we worked with the Department of Health to develop the content in more than 5 of South Africa's 11 languages that we could deliver over Health Alert. In the beginning, the service was quite simple. We provided information around case numbers, around the spread and the growth of the pandemic and the virus in South Africa, around basic information that you needed to keep yourself safe. We updated news every single day. We had information about fake news that was spreading throughout social networks. And we launched a health check that you could use to check your symptoms to know whether or not to go and get tested at a health facility, thereby alleviating the pressure on the health system and allowing them to concentrate on caring for the sick. It was a tremendous success. Over 500,000 people were accessing the line during lockdown at its peak. And over time, more than 25% of the adult population of South Africa, that's more than 8 million people, have shared more than 500 million pieces of content around COVID-19. Within a couple of weeks, we're discussing building on this success, working with the World Health Organization to launch a similar service around the world. And so Crack Squad was pulled together from a bunch of technology organizations around the world, including WhatsApp, Amazon, the World Health Organization, obviously our team as well. And then with a couple of weeks, we reached more than 13 million people in over 18 languages. As the pandemic changes, our services also have to adapt. During the first stage of the pandemic, we mostly provided information in real time to all our citizens. But over time, we are starting to think about other effects, such as economic impact on our citizens, about the spread of vaccines and how to safely and equitably get the vaccine to billions of people around the world. Looking back over the platform and the successes of the last couple of months, I think it points towards a future where we can build services to safely and securely communicate with every single person on the planet and provide them the kind of health service they need to improve their lives. Thank you.